The numbers for COVID right now, locally and around the county, they're not great. People have read in the papers, I think, or heard in the news that our vaccination numbers are really not where we had ultimately hoped they would be. So when the state of emergency was ended earlier in the year, and the big hope was that the veil would be lifted and we could start to get back to some normalcy, that was said under the pretense that the vaccinations were widely available and people would just continue to kind of roll through that process. Knowing that we would never have everyone vaccinated for a variety of reasons. There will always be some people who just won't get the vaccination for personal reasons or religious or whatever that might be. And the numbers anticipated that would be fine, that we could kind of absorb that in our community, so that would always be some people who maybe were sick, but the majority of the population would not become sick with COVID. There would not be a large number of people who were significantly sick with COVID and ended up in the hospital. And that has not panned out. So we still have a large ratio of unvaccinated people who are now proving to significantly taxed our healthcare system.
COVID is very much still in the state. It's all across the country. The winter surge is here. Here in New Hampshire, we're still managing through. We really are. There's a lot of new tools that have been put to bear, especially around the hospital system and the flexibility that we're trying to provide the hospital systems of our great state, whether it's providing additional staffing, additional licensure flexibility, additional flexibility with some of the regulations in terms of making sure that those systems remain open and viable, which they are. They are full, there's no doubt about it, but they are not closed. They're open, they're viable, and so if folks have a health condition in any form or way, they should feel comfortable and confident about engaging with their health system.
That's a tough one. Like, they are not doing well. So we need to get that message out as much as we can to make people aware. When you're driving down Central Ave this time of year, you don't see what's going on there. You see people out in the community, the restaurants are full, all those things are going on, but you don't see what's going on behind the walls at Wentworth Douglas Hospital, and they are at their limit. They are, utilizing space for patients that they've never had to before. They are rearranging staff to deal with critically ill patients who normally would be treating, other types of patients. So they've had to readjust their operating contingency there. And, WDH could speak directly to how they're managing that, but from my interaction with them, they're maxed out, and the people in our community should be aware of that. And again, that is a result of the unvaccinated population that is in there. You just don't see it when you go out to a restaurant. You don't see it when you have a family gathering. You don't see the communication of COVID, and it's not an instant display of the results of the virus. But several days later, and people are finding themselves in the hospital, and when someone ends up certainly in the ICU at the hospital as a result of COVID, it could be a fatal illness in that case. But if not, it at least is going to have that person in the hospital for a length of time. If they become if they need airway assistance and they are intubated in the ICU, they're in that hospital for weeks at best. And so what that means is that those patients get sick with COVID, end up in the hospital. In the best case, they're there to be monitored for a few days because they're on the brink of becoming really sick, but maybe they don't cross over that path and they get discharged home. That's the best case, but they're still there for a few days. The worst case are the folks who end up in the ICU. They're there for weeks. The problem is the daily numbers continue to rack up behind those people. So the hospital literally is surging with patients who are stuck there, and the vast percentage of that population that is filling up the hospital are unvaccinated people. Hope was that people would get vaccinated and would allow the community to return to some normalcy. So the community, for the most part, has returned to normalcy in the actions that we're all taking, but we don't have those vaccinated numbers to support that. So the virus has not gone away. We always knew it would never go completely away, and they predicted that we would have a rise in cases around the holidays and some of those things. So it's following that expectation to some sense, but we're just spiked exponentially beyond what they had anticipated when they eliminated the lockdown, quote unquote, because we haven't had the follow-up of the number of vaccines we need. So now we're stuck in this predicament of, you can go to the mall, you can go to the movies, you can do all of these things. And there's a wide number of people who are vaccinated and they can do that stuff safely. But just because there are so many people who are not, we have jumped back into normalcy, but we don't have the protection to keep that transmission from occurring, and we end up with a large number of people in the hospital. So here we are now, wanting to be normal and kind of living our lives as if we're back there, but the virus doesn't really care. And now it's running rampant through the community, in the non-vaccinated people, and getting a lot of them very sick. It's also, as we've come to learn, breakthrough cases in vaccinated people, specifically if you're at that 6 to 8 month mark and you have not received a booster shot. We're seeing a lot of breakthrough cases, like it literally is following that prediction almost to a T. But the positive news is that those people are not getting really sick. They're getting COVID-19. They have to quarantine. Their lives get upended. Kids are stuck home from school. Parents are with those kids, and all of that stuff is going on. But those people are not over in the hospital. So to that extent, it is somewhat where, like people always said, well, we're just going to turn into where it's just like the flu, and I'm just going to get it. It's just like the flu for those people. They experience sick for a number of days, they're down and out for a little bit, and then they're back to normal. But what is not just like the flu, where COVID-19 is, and I can't reiterate this, it is not like the flu in the sense that it's sending the unvaccinated people to the hospital in the numbers that we're seeing. So that's where we are now, where we have people kind of living normal, living almost like that, well, I'm just going to get it, it's the flu. That works if you've been vaccinated. If you have not, it is not working, and it's working really badly in the other direction. So that 6 to 8 month mark it's happening. We're seeing some breakthrough cases, and so that's my message to reiterate the need for the booster shot. The booster shot is proving to be what they predicted that would be. The need is there now, and they didn't know when the vaccines first rolled out, but as we've said all along, a lot of this is new. They're putting a ton of information and research into it. Everything that they have done so far is safe. It's proven to be safe. But they determined after the fact that the vaccine, the strength of the vaccine against the virus would lessen, and it would be in need of a booster shot. But all along predicted that it would keep the people out of the hospital with sickness, and that's what's happening. A straight vaccine, if you've decided for the first time to get one, are widely available. The booster shots are widely available. We're seeing, it's kind of the ebb and flow of availability almost week to week based on demand. And if people are finding vaccines hard to get, on one hand, I see that as a good sign because it means there's a lot of people trying to get them. On the other hand, it's frustrating for the people who want to get them. So, probably a month ago, I went and got my booster shot, literally just walked in as a walk-in appointment at CVS, and not in uniform or anything, just a person off the street, walked in and got my booster out the door in 20 minutes. That's not the case now. It's not quite as easy to get one. So, but they're still available, still no cost. All of those roadblocks are removed. But there does seem to be a little bit of a backup in the availability to actually get one. But you can go and schedule one, and you can do that. At Fire and Rescue, my goal has always been to do everything we can to make them available to the people who want them. So, like in the schools, when the schools first rolled out at the end of last summer, when the juniors and seniors could get vaccines, we went to the high school and did vaccines there for any kid who wanted one. And then they opened them up to 12 and up, and then just recently to now 5 and up. So we just finished a cycle in the public schools in Dover, and to include some of the private schools, where any 5 to 11-year-old student whose parents wanted them to have one, we went there and vaccinated almost 600 kids. And with the addition of parents who went out on their own ahead of time and got vaccines as well, I feel like we really vaccinated a large number of those students. So what we will continue to do now, in seeing a bit of a challenge for people to just go out and get a vaccine or get a booster shot, is we're going to open up. We're going to start out with just 1 day a week in the city of Dover. Most likely we'll be at the library, but we'll put that location out specifically where the public can go, or city employees or anyone, and just walk in without an appointment and get a vaccine or get a booster shot. Our goal is to start out 1 day a week and just see what the demand is. If there's a line out the door or we see that there's a need for more, we'll do 2 days a week. We'll do 5 or 7 or whatever needs to happen to just remove any barriers for people who want to get either a vaccine or a booster.
We did announce our first Omicron variant infection identified in a New Hampshire resident this week on Monday. We are aware of 2 additional confirmed Omicron variant infections in the state, and there will likely be many more to come. Specimens that are positive for COVID-19 continue to be tested for variants of concern through multiple locations, including at our public health laboratories in Concord, through our academic and medical laboratory partners at the US CDC and at national commercial reference laboratories around the country. And based on what we're seeing in other countries and in other areas of the US, we expect that Omicron is going to increase, and there will be an increasing proportion of Omicron infections identified in the coming days. I think that highlights the importance of everybody 5 years of age or older getting vaccinated against COVID-19, and everybody 16 years of age or older who has completed a primary vaccination series to get a booster dose. Booster doses are now authorized and recommended for everybody that has completed a primary series who's at least 16 years of age or older.
I wish I didn't have this message, because last year I was hoping that we would be well beyond this, but you can't sugarcoat the truth. I mean, it is what it is, and we are in a similar situation. Actually, the truth is that we're in a worse situation now than we were last year. The numbers at the hospital are over twice, in the inpatient COVID patients, and the numbers of people that are in the ICU, either intubated or otherwise in a just serious health condition. Back in January, again, during the state of emergency, before any vaccines, the numbers now are more than twice what they were back then. So again, I think people have a bit of a false sense of security as to where we are, but the truth is we are not there at all. So last year, again, we talked about Christmas. Like, Christmas for my family was just the 4 of us. We sat at home, there were no relatives over, and that was the general message across the board for everyone. And people were kind of aware of that. For the most part, people just knew they had to keep a reduced number of members at their house for Christmas and Thanksgiving and New Year's. Now, again, that feeling is kind of dissipated for a lot of people, but my message is that kind of hasn't. So asking people to just be aware of the holiday season and the interactions that people have with a large number of family members, especially elderly and some of those other groups. We think that what we see at the hospital now is in part a result of the Thanksgiving get-togethers that people had, and everyone, kids home from school and just people getting together again. We're seeing the results of that now, and there's no reason to think that we won't see the same results around Christmas and New Year's. So I would just ask people to consider backing that down a little bit and not have a Christmas that they would have had 2 or 3 years ago. We're just simply not there.